Hi, I'm Dr. Parijat Kumar, Certified Spine and Sports Specialist from USA. I'm the current founder director of International Sports and Orthopedic Manual Therapy. I want you to meet my friend Tipsy. He's a gym trainer, and I've been training him for the last 2 days on how to apply electrical modalities and do some exercises. And guess what? He is a certified physiotherapist now in just 2-day workshop. Sounds weird, correct? Please watch this video. Guys, I have been practicing here in India for the last many years, and I've seen a trend over here that many therapists or physiotherapists, they have been adding names like certified chiropractors or certified osteopaths in front of their names. And that actually makes me sad, or I don't know, either to laugh or to feel sad, because you cannot be a certified physiotherapist or a certified chiropractor or a certified osteopath in all the three. These are three different disciplines. A doctor in chiropractor is a 4-year degree program which is done after your undergrad in a science program. Similarly, a doctor in osteopath is also a 4-year degree program, after which people can do many residencies. Both of these programs include an extensive 300 to 500 clinical training in the manual therapy. So I don't understand, by just doing 2-day or a 5-day or a 10-day workshops, how can you be a certified chiropractor or a certified osteopath or even a certified manual therapist? Physiotherapy, manual therapy, these all are motor learning programs. You cannot become a certified physiotherapist like you saw in the video before, or a certified manual therapist in just 2 or 5 or 10 days. It's like I'm learning how to drive or swim in just 2 days. Now, there are justifications for many people which say that you cannot really be one, but you can learn the concepts of that and then practice after that. My humble question to you is that what you are practicing after learning in a 2-day workshop, who is actually supervising that? Who is actually seeing that what you are practicing or applying those techniques are correct or wrong? What is happening these days is like, I'm sleeping as a physiotherapist on Friday and getting up as a certified chiropractor on Monday. Guys, please don't do that. Please don't lie to yourself and to your patient. I totally understand the Google reports and the marketing and the westernization of these YouTube and fancy videos, that patients do ask for chiropractors and these professions like that. But you have to educate your patients and the society that you are not one. You can do chiropractic manipulations or some osteopathic techniques, but you are not a chiropractor. You can do those techniques. You have to educate your patient. We understand we need to practice in the market and earn our bread and butter, but you cannot lie to your profession and to yourself. So please stop adding certified chiropractor, certified osteopath, certified this and that in front of your name. In the beginning of the video, I mentioned myself as a certified spine and sports specialist because I am one. I do a lot of manipulations, but I don't apply certified chiropractor in front of my name. I have specifically added what I have done. So guys, please don't fall into these marketing traps of business minting workshops and courses where they are making you certified chiropractor and manual therapist in just 5 or 10 days. Do a proper manual therapy evidence-based program and ethically. Finally, I would request all my professionals and friends to please speak truth to themselves first and to the patients there. Thank you so much.